Can you see my slides?
Yes, po,
Yes,
Lord.
no.
Yes, po.
All right. Dali ha. Paano ba to? Okay. Good morning once more. Sige, dito na tayo. My topic for today is scalp and face. And you know, face is very important in our lives because God has given us one face, and let's not try to make another one. Make yourself a happy face. Wash your face every morning in a bath of praise. So, learning objectives. By the end of this lecture, you will be able to at least know the anatomical boundaries of the face and the scalp. Kita natin yung structure and function of the muscles of facial expression. Identify or describe the blood supply also and innervation of these muscles, including the scalp. Relate the anatomy of the face and scalp to clinical correlations. Okay, let's start the scalp. As you know, the scalp is soft tissue which covers the, we say, calvaria of the skull, neurocranium. The scalp extends from the external occipital protuberance dito and superior nuchal lines of the occipital bone to the supraorbital margins of the frontal bone. This is just the top of your eyebrows. And laterally, syempre hindi lang sa gitna. Laterally naman, it covers the temporal fascia up to the cheek. The bone cheek, zygomatic arches here. So that comprises the scalp. Scalp stands for S, skin, C, connective tissue, A, aponeurosis, L, loose areolar connective tissue, and P, pericranium. Those are the scalp layers. So it is seen in the image. And by the way, this SCA, SCA, the first three layers ito are bound together as a single unit. Talagang nagkakadikit ito. The unit is sometimes referred to as the scalp proper. And this is the tissue torn away during serious scalping injuries. Ito talaga yung pag ma-injured ang scalp, ito yung medyo natutuklap. Kasi alam naman natin the loose areolar connective tissue and the pericardium, yun man ang medyo loose naman ito. Dito yung nag-give way. So ito yung, the first three layers are really bound together. So another image, another drawing, going to show to you the scalp here. This is the skin. No? Skin naman, it's very thick and it is hair-bearing, of course, and contains numerous subcutaneous, sebaceous, and sweat glands. Ito yun. And because of this, the scalp is common site for formation of cysts, the sebaceous cysts. So this is the skin, and now the next layer is the connective tissue, and this is just beneath the skin. It is a very dense layer composed of fibro-fatty tissue. Kaya makikita dito yung red lines, no, they're actually fibrous tissues. It's like a septae. They unite the skin to the underlying aponeurosis. Thus, they connect firmly the skin and aponeurosis, kaya sinasabing one unit sila. And this layer, yung connective tissue, contains large and numerous arteries, large amount of numerous arteries and veins dito. And these arteries are really attached to the septae. So the walls of the vessels are adherent to the fibrous network, so that when the vessels are torn, there's rupture, or there's injury, assuming there's an open wound, they are unable to retract. Hindi sila nag-constrict because of the adherent fibrous tissue surrounding. And they produce profuse bleeding, even from a minor scalp injury. Siyempre, because of the presence of the bone, and if there's a cut here, and if you have a bleeding, all you have to do is just to control it, no? By just pressure. Put pressure here, put your hands, or siyempre, clean cloth, and you have a controlled bleeding already. Because this is fibrous, if there is a hematoma formation, because this is closely attached, the pain with little swelling due to the fibrous and an unyielding reticulum of the layer, medyo masakit ito. Kasi parang pinipilit siya inuunat, kaya masakit. So painful. So generally, scalp has a rich blood supply, and it's the reason for rich blood supply is to give nourishment, especially the sebaceous glands. So after the skin and connective tissue, we now go to the aponeurosis, aponeurotica and epicranium muscle. So the epicranius includes the occipitofrontalis and the variable sleep known as the temporoparaetalis. Ito yun, this area. So it's actually a flattened tendon that unites the frontalis muscle. There's a muscle belly here, and it becomes a flattened tendon. It's like a flat sheet, white sheet that unites the occipital, that unites to the occipital muscle belly here, behind your head. So this is the occipitofrontalis aponeurosis. So ito naman, yung occipital bellies are separated from each other. Hindi ito buo. Medyo there's a belly of muscle at the left side, and there's a belly of muscle at the right side, at the other side. But they are linked together by a flattened tendon, a flat sheet. The frontal belly naman ito have no bony origin. Ito yung pagkakaiba ng muscles sa extremities, no? Sa facial. Ito naman, wala siyang bony origin. So they are longer and wider and are approximated to each other in the median plane. So each belly arises from the skin and subcutaneous tissue of the eyebrow and the root of the nose. And then they go to the aponeurosis. So the frontalis is supplied by the facial nerve. Their action is to move the entire scalp forward and backward. Once you raise your eyebrows, you're actually working your occipitofrontalis muscle. So once you do this, there's already the facial expression as in surprise or horror. Next is the temporoparietalis. It is a variable sheet of muscle which intervenes between the frontalis above and interval between auricularis, anterior and superior muscles below. So it arises from the gallia poneurotica. It is inserted into the root of the auricle. So temporoparietalis arises the auricle and is supplied by the temporal branch of facial nerve, the same. So this is part of the aponeurotica epicranium muscle, that layer. So again, gallia poneurotica, and this is the gallia poneurotica, and this is the frontalis belly muscle connected with the aponeurotica, and behind it is the occipital belly. The gallia is sensitive to pain. Ito yung nakakatakot ito once you have incised wound transversely of this gallia poneurotica. Since there's a muscle here and there's a muscle here, the tendency here, if you have a transverse incision, it will really gape wide. So after the aponeurotica layer, you have the L, loose areolar tissue, from the skin, and then you have connective tissue and the poneurotica, and this is the loose areolar tissue. So it contains small arteries, but also contain some important emissary veins. The emissary veins, so yun, no? Usually galing man yan sa sinuses, and it goes through the skull, passes through the periosteum, and goes inside the connective tissue. And they are devoid of valves and communicate the veins of scalp with intracranial venous sinuses dito. Any infection in the subponeurotic space with accumulation of pus may spread the infection into the sinuses. And once there's an infection here, this can cause meningitis. So this is called a dangerous area of the scalp, the loose areolar tissue. Black eye phenomenon. I believe some of you has noticed that kung meron tayong hematoma somewhere in the forehead, eventually it will cause a black eye. I don't know if you have noticed that. This is because if there is a hematoma within the loose areolar tissue, there's a hematoma here, collection of blood. It usually passes through anywhere, usually by gravity. And from the scalp, forehead, there's a hematoma. It will just flow down and goes and exit to other loose areolar tissue, and it goes to the one of the softest part of the face, specifically the periorbital. And that's why you have that black eye phenomenon. And the blood flows from the forehead. It goes to the periorbital. It gravitates into the periorbital and the eyelids, and you have that black eye phenomenon. Now we go to pericranium. This is the deepest layer of scalp. It is the outer periosteum. This is the bone. The outer part, there's a layer. That's the periosteum. And loosely covers the bones except at the suture lines. So itong cranial bone natin, meron pang layer siya. Hindi naman talaga naka-attach. It's loosely attached. But once it has reached any suture line, somehow medyo super adherent ito sa suture line. And it becomes continuous with the endocranium through the suture membrane and beneath it, beneath the inner lining of the cranium. And that's the endocranium. So endocranium naman is derived from the endosteal layer of the dura mater inside. So it's not our area of lecture already. This will be lectured by another in neuroanatomy. Now, this periosteum naman, diba, it's loosely attached to the skull below, but it's firmly attached at the suture line. If ever there is a bleeding, if there's a hematoma formation between the periosteum and the skull, the collection of blood here will not go beyond the suture line. So dito lang magkakaroon ng hematoma. So some of the head trauma, actually, there's a hematoma here. There's a localized hematoma that does not spread to other areas. It's because it's within the periosteum. So you've heard probably cephalhematoma. You've heard traumatic cephalohydrocele, especially in children. So this is the mechanism. Now that's the layers of the scalp, 5 layers. We now proceed to the sensory nerve supply of the scalp. So the nerve supply of the scalp come from 2 major sources, the cranial nerves and the cervical nerves, depending on whether it is anterior or posterior to the ears and the vertex of the head. So ito yung ulo. This is anterior and posterior. And you can see here nerves in front of the ear, anterior to the ear, and the nerve supply posterior to the ear. I'm talking about sensory nerve supply. So the anterior to the ears, it came from the branch of all 4 divisions of trigeminal nerve. So remember, yung sensory part ng scalp comes from the trigeminal nerve. The supratrochlear, supraorbital, zygomatic-temporal nerve, auriculotemporal nerve. And the posterior to the ears, they come from the branches of all 4 divisions of the spinal cutaneous nerve. These come from the cervical plexus. So that's the sensory nerve supply. Just remember, we have two sensory nerve supply coming from the trigeminal nerve and the spinal cutaneous nerve. So for the arterial supply, now, you know, the scalp has rich blood supply to nourish the hair follicles. And for this reason, the smallest cut bleeds profusely. And the scalp arteries lie in the superficial fascia. So the arterial supply, here we have the supratrochlear artery, supraorbital artery, zygomatico temporal artery. And all of these are in front of the ear. And we have also posterior auricular and occipital carotid artery. You may notice here that the blood supply of the anterior part, the supratrochlear and the supraorbital, comes from the internal carotid artery. This is not coming from the external carotid, but from those superficial temporal, posterior auricular, and occipital, they come from the external carotid artery. So I just want you to understand this blood supply, that the blood supply form a network here. They interconnect each other from the internal carotid and from the external carotid artery. So if you have a problem in the internal carotid, I guess somehow the external carotid can help out in supplying here because they form a network. This is a rich blood supply in the skull. So another view here. This is the external carotid artery, and they branches off to supply the face and even the scalp. And there's the internal carotid artery, goes inside to supply your brain. But somehow a branch, the ophthalmic artery, goes out from one of the foramen there and goes out from inside, from the inside the scalp, goes out and branches to supraorbital and supratrochlear arteries to supply the forehead. This is interesting here. And the rest of the scalp, they are supplied by the external carotid artery. The superior temporal artery, posterior auricular artery, and the occipital artery. Now we go to the venous drainage. The veins of the scalp also freely anastomose with one another. They follow a pattern similar to the arteries. Of the deep part and are connected. They are connected to the intracranial venous dural sinuses, as I've mentioned earlier, through the emissary veins. So yung mga venous deep sinuses may link yan to the scalp through the emissary veins. So the same as in artery, meron siyang supratrochlear vein, supratrochlear, supraorbital vein, and it forms a facial vein here. And there is also posterior auricular vein. There is a superficial temporal vein, and also the occipital vein. And the occipital vein drains into the suboccipital venous plexus, which lies beneath the floor of the upper part of the posterior triangle dito na sa neck, and in turn drains into the vertebral veins, or even directly to the internal jugular vein. So I just want to give you the idea, not necessarily memorizing all these, that a good number of venous anastomosis also happen here. Hindi ito magulo na venous drainage. Somehow they go together and they follow the pattern similar to the arteries. Unlike sa So veins, the venous drainage of the thyroid, if you remember, hindi siya talaga nagfa-follow sa pattern ng artery. But this one, if there's a supratrochlear artery, there's also a supratrochlear vein. If there's a supraorbital artery, there's also supraorbital vein. So they follow a pattern. If there's a superficial temporal vein, there is the same. There's an artery there. For the lymph drainage, the lymph vessels in the anterior part of the scalp, the forehead, drain into the submandibular lymph nodes. So if this is the forehead, it goes down to the face and the nose and the facial. It passes to the buccal and there, the submandibular nodes. From the forehead, it goes down and it becomes submandibular. Drainage in the lateral part of the scalp, your parotid, and also part of the retroauricular, they go to the occipital nodes and drain into the upper cervical nodes. So there's a retroauricular, behind the scalp is occipital, and there's also the retroauricular or mastoid nodes behind. And it goes to the cervical nodes. And there's a nodes that follows the length of the sternocleidomastoid muscle. So soon when you reach second year, you'll have clinical, and once you make an examination, you have to really palpate the scalp, palpate the soft tissue behind the ear, behind the head, at the lateral neck, to check if there are masses. This is this anatomy of the lymph drainage is also important, so that during your examination, once you see a patient, during your training in the clinical, you have to learn how to do palpation so that you can easily identify those nodes and the neck, submandibular, occipital, etc., etc. Normally, you don't palpate them, but once they are enlarged, then you can easily identify. And if you have identified that there is a submental nodes, there is a masses below your mandible, this could be a lymph node. You can think all kinds of possibilities here. So clinical, as I mentioned, if there's a mass at the scalp, or you can think subcutaneous, the sebaceous cysts, because a lot of sebaceous glands are present in the scalp. So, and also anatomically, it is also useful to remember in emergency, assuming there's a trauma, that all superficial arteries supplying the scalp ascend from the face and the neck. You just imagine na yung scalp. Pag may sugat talaga yung scalp, isipin natin talaga, yung mga blood supply ng ulo natin comes from all the sides. It comes below the forehead, below the temporal, below the occipital, and it goes up to supply the rest of the scalp. Kung meron kang profuse bleeding, pwede kang mag-tourniquet dyan. Para kang nagkakaroon ng headband just to control the bleeding at the vertex part. I hope you can imagine that. So occasionally, you know, an infection of the scalp spreads by the emissary veins, which are valveless to the skull bones. So this can cause osteomyelitis. Not only osteomyelitis, it can cause meningitis also, if it has reached to the venous sinuses. All right, now we go to the face. We value face. We have learned, by the way, the boundaries of the scalp. Now we have to know the boundaries also of the face. You know, it extends superiorly to the hairline. Dito nagsa-start yan. Kung saan nag-start ang hairline mo, that's the superior border of the face. And inferiorly, just below the chin and base of the mandible. The laterally, yung ears mo, in front of the ears. So that's the border of your face. Forehead is common. And if your face reaches the hairline, your scalp reaches naman the eyebrows area. So this is common between scalp and the face, the forehead. Face is very vascular. It easily blushes and even blanch. The same as scalp, no? If there are wounds, the face can bleed profusely but heal rapidly. And facial skin is rich in sebaceous gland and sweat glands. Kaya meron dyan mga nagpipimples. They're just normal. But of course, if it has gone beyond control, there's an infection, and there's a blockage of the ducts that is the one causing the pimples and acne. So sebaceous gland keep the oily skin, but also cause acne in adult. Face musculature. There are two sets of muscles: muscles of expression and muscles of mastication. And we will learn also that somehow these muscles connect to the person's feelings. The muscles contract to manifest an expression. And interesting to note for facial muscle is that unlike in the extremities, as I've mentioned earlier, unlike sa mga body natin or limbs where they insert to the bones or tendons, most of the muscles insert into the skin. That's why we are able to move the tissues, whatever we want. Pag na-raise mo, it's not the bone that we raise a tissue. If we want to raise an eyebrow, it's not the bone that we raise, it's the tissue. So they are attached to the skin and subcutaneous tissue. The openings of the face, no? What are the openings of the face? These are the orbits, the nostrils, and the mouth. So it is the function of the facial muscle to serve also, since opening ang eyes, it's a function also to protect the eyelid, the nostrils somehow, and the lips. It is the function also of the facial muscles to serve as sphincters. If you close your eyelid, it's more or less a sphincter. If you open your eyelids, it's a dilator. It's the same thing as your mouth. It is a sphincter. If you close your mouth, it's a sphincter. If you dilate them, it's a dilator. And secondary function lang is to modify the expression of your face. All the muscles, by the way, are developed from the second pharyngeal arch and therefore are supplied by the facial nerve. The face musculature most arise from the bones of the skull and are inserted into the skin. So as I've mentioned, these are sphincters, dilators, and they come from the second pharyngeal arch. So let's go to the muscle of the scalp. I've mentioned this already, the frontal belly and the occipital belly. The insertion of the frontal is the subcutaneous eyebrow and the skin and the forehead. And the insertion also for the occipital is the aponeurosis. And the action here is to raise eyebrows. It wrinkles your forehead. It retracts scalp backward. It's like an expression of surprise. So ang function naman ng occipital muscle, belly, it retracts scalp to increase the function of frontal belly. Muscle of the eyelids, you have orbicularis oculi, and the orbicularis oculi has an orbital part and the palpebral part. So it really surrounds the eye, including the eyelid, part of the orbicularis oculi. For the action of the orbital, those muscles around your orbits, if you use that muscle, you actually close the lids tightly. Talagang pinipikit mo yung mata. The action of the palpebral naman, if you act your orbicularis oculi, it closes the lid gently. It's just closing your eyelids. That's part of orbicularis oculi. Levator palpebrae superioris naman is the one that raises your upper eyelid gently. So all of these are supplied by the facial nerve. So example of the orbicularis oculi, if you palpebral part, you just close it gently, but for the orbital part, pwede ka magpurumus to close your eyes tightly, just like this one. We have the muscles of the nostrils, compressor naris, and dilator naris. As it's understood, it is the sphincter muscle of the nostril for the compressor naris and dilator naris. It dilates the nostrils. Now we go to corrugator. Corrugator naman, the origin comes from the medial aspect of the eyebrow. And it inserts the skin superior to the supraorbital margin of the eyebrow, midline. So once the corrugator contracts, it draws the eyebrow together. It draws the eyelid, the eyebrow medially, creating vertical wrinkles above the nose. It's like frowning. So it is an expression of annoyance or skeptical or worried look. Procerus. Saan ba ito galing? Procerus naman is a facial aponeurosis with a muscle covering nasal bone dito. Dito yan galing. So it inserts to the skin inferior to the forehead, between eyebrows. So may muscle galing yan dyan, muscle dito, tapos i-insert doon sa just inferior of the forehead, between eyebrows. So once it contracts, it depresses the forehead. It depresses the medial end of the eyebrows also. So the wrinkle is more or less transverse, hindi siya vertical kagaya ng corrugator. So expression is like disdain or dislike. Next we have the muscles of the lips and the cheeks. For the muscles of the lips, we have orbicularis oris. It is considered the sphincter muscle. And the rest are the dilator muscle of the lips. And there is a levator labii superioris. There's a levator labii superioris alercae nasi. That means it's connected to the nose. That's the most medial part. More lateral part is the levator labii superioris, and lateral to the levator labii superioris is your zygomaticus minor, and more lateral and the angle, and from the angle of the mouth is the zygomaticus major, and goes up. It links to the bone of the zygomaticus. Actually, the origin comes from the zygomatic bone, zygomatic process, and it goes down to the orbicularis oculi here, as I mentioned. So all of this acts as if it dilates the mouth. Rhizorius naman, rhizorius should be here. And the levator angularis should be. So these are all dilator. For the depressor angularis is here. Just below that, the depressor labii inferioris, more medial na, and mentalis. All of these act as a dilator. So there is an upper group of muscles, as I mentioned, the levator labii, levator labii, levator angular oris, zygomaticus, and rhizolius. These are the upper group oral muscles. And the lower group of muscles around your lip, the depressors, including the mentalis. So orbicularis oris, yung action niya, it closes your mouth. It also protrudes your lips. And if you blow, it resists this tension when blowing. So it closes your mouth firmly also. For the levator labii, this is the one, levator labii, and levator labii with nares part. It opens your mouth, retracts or everts the upper lip with a snarl look. Pwedeng sadness, pwedeng a little smile, or even disdain. It can be interpreted many. But more or less, this dilates your mouth. Zygomaticus major and minor. This is the minor and the major one. Generally, they are the muscles of smile. Most importantly, the zygomaticus major. That's a muscle of smile, the smiling muscle. It should act, syempre, bilateral. But if you act only one-sided, I guess hindi na smile yan. Baka sa iba. But it is also interpreted as a disdain or sneer if you smile unilaterally. So the muscles of expression here for the occipitofrontalis, it's like a surprise. It raises your eyebrow. In corrugator, it's frowning, and so on. Now we have also muscles of the cheek, and that's the buccinator. And the buccinator muscle fibers pass forward, forming a muscle that actually restricts bulging of the cheek. So when you try to blow, that muscle will compress, will control the excessive protrusion. And also if you eat, it controls also the food. It stays inside. So that's it for the muscles of the face. So break tayo. Anong muscle that raise eyebrows? Give me an expression of surprise.
C.
C.
It is occipitofrontalis. Okay. So we have motor nerves of the face. By the way, hanggang anong oras lang tayo?
Kung kailan ka po matatapos, Doc?
Are you sure?
Yes, Doc.
Okay, I thought hanggang 9. Sige, bibilisan natin. So now we go to motor nerves of the face, facial nerve. That's one that's important nerve for the face. It's the 7th cranial nerve. It enters the internal acoustic meatus in the area of temporal bone. Sa loob ito, the base of the bone. And then goes through the facial canal. And finally, through stylomastoid foramen. My goodness, this is the only cranial nerve which passes through foramen. And it has, it's not motor nerves lang, ano? Yes, we have motor component for facial expression. It goes also to the muscles of the ear. It has also sensory component. It receives sensory information from the anterior 2/3 of the tongue. So I guess it can affect the taste of the anterior 2/3. Again, the same facial nerve, just as it emerges from the stylomastoid foramen, it now supplies the posterior auricular, the occipital belly of occipital frontalis muscle. And the muscle branches, it gives a branch to the stapedius, part of the ear. That's a small muscle. And also posterior belly of digastric and stylohyoid muscle. That's the muscle of your neck. And this facial nerve now passes through the parotid gland. Once lumabas na ito sa stylomastoid, it will go through the parotid gland. Inside, it really goes inside parotid gland. And within it, it gives 5 terminal branches to the facial muscles of expressions. So isipin mo, nasa loob ito ng parotid gland, pumapasok pala siya. And inside the parotid gland, it branches off into 5. And the 5 are temporal branch. As we know, this supplies the frontal belly of occipitofrontalis, the one that acts your eyebrows. That's a surprise, that raises your eyebrows. Temporal, so the temporal branch supplies the orbicularis oculi, of course the upper part lang, and the corrugator. We have the zygomatic branch. It supplies the orbicularis oculi lower, and the buccal branch buccinator, also part of the orbicularis oris. The mandibular branch, muscles of the lower lips, the cervical branch, platysma, and the pressor anguli oris. So the 5 branches. Give you an idea also. Again, once lumabas ito from the stylomastoid foramen, there's a branch, no? There's a posterior auricular, it supplies your occipital. And there's also a branch that supplies your digastric muscle and the stylohyoid muscle. There's a small branch that goes to your stapedius. And this facial nerve goes into the parotid gland. And inside the parotid gland, they branch off now. As I've mentioned, it goes to temporal, and there's also the zygomatic, and buccal, marginal, and the cervical branch. So that's the appearance of the branching of the facial nerve inside the parotid gland. So another view here, this is the main trunk of the facial nerve. There's a posterior auricular that supplies the occipitofrontalis, the occipital belly, and there's a branch that goes to the digastric muscle, to the neck, and it goes through the substance of the parotid gland. And inside the parotid gland, the facial nerve divides. Ito na yung 5 branches of the facial nerve. So again, facial nerve, 5 branches. Number 1, temporal. Number 2, zygomatic. Number 3, buccal. Number 4, marginal. Number 5, cervical branch. As I mentioned again, the facial nerves control the facial expression, including salivation, kasi parotid na, and lacrimation. And it is a pathway also to the taste. I mentioned, di ba? Anterior 2/3 of the tongue. That's the major part of the facial nerve. So clinical notes on the facial nerve. So facial nerve paralysis can be caused by many. For in non-trauma, wala naman sinuntok or sinaksak or binaril. In non-trauma lang, any inflammation around the nerve can lead to secondary inflammation of that facial nerve. So once you have an inflamed facial nerve, it can lead to paralysis also. And it usually happens in the stylomastoid foramen. Kasi dito yung medyo nagsisikipan. Diyan naman ang area na maraming tissue, maraming different parts of organ. It can be muscle, it can be inner ear also. Exposure to extreme cold, somehow, probably for 30 to 50 years of an exposure, eventually you can have facial nerve paralysis. Nerve can be injured during parotid surgeries. There are mumps in case there are hypertrophy or tumor of the parotid, and we have to remove the parotid gland. And there are some cases that you can actually injure the facial nerve. Then one has to do a very careful surgery if we remove the party gland. Dental manipulation also can somehow injure the facial nerve. Infection of the middle ear because of its proximity. Trauma, gunshot wounds, stab wounds, mauling. This can cause facial nerve paralysis. So what are the manifestations of facial nerve paralysis? Okay, if which one here is the paralysis? Right or left? This is the right side of the patient facing the patient. This is the paralysis side. Note, there are no wrinkles. If you have paralysis, you have no wrinkles. You cannot raise your eyebrows. So it doesn't mean that one of the treatment for wrinkler in aging is to paralyze your facial nerve. Hindi naman. So there is no wrinkle at the eyebrow. There is a drooping eyelid. You cannot close your eye. You cannot open wide your eye because there is a paralysis of the superior levator palpebral. There is inability to puff the cheek. Medyo saggy ito or no muscle tone kasi yung vaccinator mo is not is has a poor tone because of the denervation. There is a drooping mouth because of this. All the muscles sag. You cannot smile because you have a paralyzed zygomaticus major. So the tendency here, the effect here, if you cannot close your eyelid, you can have a drying of cornea kasi hindi ito ma-close. For those patients who have Bell's palsy, the patient is being advised that to close the eyes more often so that it can prevent dryness of the cornea. You cannot whistle because the other side of the orbicularis oculi is paralyzed. You cannot give a good pouting. Probably you cannot kiss. Since this is paralyzed, the corner of the mouth is somehow displaced or partially open. So food and saliva can actually drip here. There can be a drooling of saliva here. So that's the Bell's palsy. Have you encountered Bell's palsy? I have encountered Bell's palsy many times. For those who are physical therapy graduates, I hope you have encountered Bell's palsy. Sensory nerves of the face. The skin of the face is supplied by the trigeminal, just like the scalp, except for the small area of the angle of the mandible and the party gland, which is supplied by the greater auricular nerve, C2, C3. So the trigeminal nerve divides into three major divisions: ophthalmic nerve, maxillary, and mandibular. Tatlo yan sila. Ophthalmic, maxillary, mandibular. And the mandibular has the largest and most inferior. And this exits foramen ovale before going out. Yung maxillary naman, maxillary nerve, exists through the foramen rotundum. Yung ophthalmic, it goes through the superior orbital fissure. So the sensory of the face comes from the trigeminal nerve, and the trigeminal, there are three divisions. This is the ophthalmic nerve, the forehead, and the upper part of the scalp. That supplies that is the responsibility of the ophthalmic nerve. And for the maxillary nerve here, it supplies the zygomaticotemporal here, intraorbital, excuse me, the cheek, the upper lip. That's the maxillary nerve. And for the mandibular nerve, it supplies the auriculotemporal part, the lower lip also, and part of the ear. Wala akong COVID, ah. So this is the trigeminal nerve. And behind it is the one that is supplied by the cervical plexus and also spinal access. Okay. So what supplies the forehead? Okay, ophthalmic nerve. Now, blood supply of the face. Alam niyo na. I think I mentioned ito kanina. So blood supply of the face, I think I mentioned that there are two, even the scalp now, there are two sources of the blood supply of the scalp. So the same thing, there are two sources that supplies the facial. It's from the external carotid artery and also comes from the internal carotid artery. So what did I say about the internal carotid artery earlier? So we know that most of the arteries are derived from the external carotid. The superior, the supratrochlear, and the supraorbital are branch of the ophthalmic artery, which arise from the internal carotid artery. Comes from the internal carotid. So the rest, the one that supplies your zygomatic, the transverse facial, the one that supplies your nasal, the maxilla part, the maxillary artery, and the labial arteries, superior, inferior supplies the mouth area, mental, all of this comes from the external carotid artery. And also the temporal part comes from the external carotid artery. Even behind the ear, posterior auricular, occipital arteries comes from the external carotid artery. All right? Now, so which of the following vessel is derived from the internal carotid artery?
Letter C po.
Come again?
Supraorbital.
Yes, it's supraorbital. Okay, guys. Thank you.
Thank you, Doc.